Good morning, everybody. It is August Buyout. This is the Almost Live. I'm going to be hanging out with you guys for the next few hours. I don't know how long the video is going to be. I'm going to be hanging out here for the next few hours. We have 20 horses here already. As far as I know, it's 20. It's supposed to be 20. And we're going to be getting them unloaded and intaked. And my hair's flying. It's warm today. It's not too hot, though. It's only supposed to be like a high of 82. So thankful for that. And I can't wait to meet the horses that we rescued today. Supposed to be some really pretty horses on this trailer. So we'll see. But they're going to be coming up here soon. Going to be unloading. We're going to get right with it. Dr. Lydia is the vet on duty today. Dr. Gina is, unfortunately, one of her kids is sick. So she's doctoring her own kid today. Not medically doctoring, just hanging out with her kid. And that's totally fine. Dr. Lydia's got it. So here we go. Everyone is just hanging out, waiting for the trailer to come. So this horse was from last buyout, and he's not doing good, unfortunately. And then this was just his buddy, and Dr. Lydia just can't help but practice medicine, so she's over there just checking out the horse, making sure he's doing good. And Tawny's doing important things, and Haley's hanging out waiting to video. And then we've got Haley waiting to handle horses, and Faye's running. Oh, where's Faye? Oh, there's Faye. And Justin's doing the members videos for you. So
if you want to join the membership, make sure to click the little join button just down below. Or I think Dad'll put a link in there or something.
No links.
Not in the description or nothing?
Probably not.
Anyway. Well, I'll figure it out. If you guys ask in the comments, I'll direct you to it. But yeah, there's daily videos around the shelter every single day I post, so go check it out.
And we're waiting. And here they come off the trailer, too. Three. Four.
Good job.
5. 6.
Brandon? Brandon, that one. There's a lot of standard breads. Brandon, they're right next to you.
7. And 8. Just keep coming off. It's a big trailer.
And colts with them or not?
Do they act like they're studs?
No,
If they're fine. Hi guys. We have all of them. All standard bread things.
9. And 10. 11, 12, 13. 14. 15. Maybe 16. I probably lost track now.
Oh, watch that gate on the other side. Hi. How are you?
There we got 17 and 18.
And 19.
19.
That was not. And one more.
You got somebody to lead this thing?
Yeah, Haley. Oh, me. Was it a stud or is he blind?
It doesn't matter. She's exposed to the stud in the front. The stud in the front.
Whoa.
Big horse, no manners.
Hold on, let's open it and take her out to she's blind. Yeah.
Haley.
Ooh. Alright, Haley, if you can take her out that way, that's fine. God, she's gorgeous.
I'm going to pull up for the stud in the barn.
Yeah.
Make like these.
Percheron colts that we had? Yeah. Oh my.
Wow.
What are you?
That mane though.
So this is a big old stud, and
Can you see this? Look how bony he is.
very, very, very skinny.
Looks like he was down for a good while.
So this guy's going into a stall. I'm sure Dr. Lydia is gonna be tending to his every need.
Easy. No, you can't see because your hair is in the way.
What a huge horse, but so skinny. So this is one of the horses. So we're getting his intake photos.
And good, I'll grab this side.
Dr. Lydia is saying it looks like he's been laying down a long time just based on his mud. At least he definitely laid down in something dirty.
I need a blood sample. Are we good on photos? Let me just hop over and grab just a few more. Justin, if you can also try to get really good photos for us. We don't have good photos of our people. Be about 27 years old. I've only gotten a look at his incisors very briefly on one side. He is not a cryptorchid. It's always depressing when we see really old stallions with only one testicle descended because it's a heritable trait. He is a pretty thin body condition score. I BCS'd him at 2 out of 9. And my biggest concern is that he's got evidence of DSLD, which is deep suspensory limb desmitis, in both of his hind legs. And he's got really engorged blood vessels in those hind legs and some effusion in his hocks, which is an indication that we're kind of at an end stage of the disease process. And if you watch him when he's resting, he doesn't hold all of his weight on his hind legs. He kind of balances up on his toes, which is one of those indicators that those tendons are really hurting when they're standing. So I'm gonna get him some pain medication right now. And I pulled some blood for a CBC chemistry and for his Coggins test, and we're gonna pop him in a stall and let him have some hay and some water and decompress a little bit. All right, handsome boy, how are you for having things put in your mouth?
Stallion.
Okay.
How old did we say he was?
27-ish.
So this horse seems to be completely blind, and Dr. Lydia is checking him out. See what's really going on. It's completely blind in both eyes.
She's supposedly pregnant with that horse's baby.
And she might be pregnant with the big white
We'll
stallions.
definitely need her in the chute area.
Will she fit? She got a bit of a wide butt.
You definitely had more
Well, I
than one
think
baby. Hi, I'm gonna touch you again,
in
okay?
that shoot at least, and then back around.
What a big horse.
You're all right. You're a good girl. Okay, I'm gonna turn her so you guys can get photos of this other side.
And I need photos.
Good
Emily, did you
girl.
get photos of
I
this
know.
side?
I know you can't see.
Emily
the way
has
she was
not
standing.
gotten
Okay.
photos of this side.
I didn't want to spook her from being behind.
Good girl. Good girl. You're a good girl.
Is she she's completely blind.
Nasal discharge. Easy.
Anything you want to say about her?
I don't have any information yet. She is fully blind. I don't have an age. She does have mammary development, but looks like she's lactated multiple times. Her body condition score is decent. She's got feces caked on kind of her whole lower body. Ooh. Emily, just be careful back there. Yeah, I wouldn't stand right there. She can't see at all. Mama. Good girl.
She's getting her blood pulled.
Did we say she's a Percheron too? She's a Belgian?
Good girl.
Which one? The black one? He's from the 10 acre. His card. Check on the thing for the squeeze.
Dr. Lydia is checking lungs and heart. See what's going on with her.
Good girl.
Dr. Lydia is getting the ultrasound out to preg check the great big draft mare. It's a huge complication that she is blind in both eyes, but we are absolutely going to get her preg checked is the plan, and see how it goes.
How much August photo?
Okay.
I think you need to get new photos of that horse.
All right, big blind draft mare coming out to get preg checked.
It says hi.
And oh yeah, Haley is back. She's actually going to be here till like December this time. So
Yeah, if you want to just
super excited to have her back. She doesn't know anything, so as far as where she's at spatially, because she's blind, and could easily take out a table and x-ray machine or just about anything. So it's a little bit high risk with this big of a blind horse, but we're going to be just letting her know where we're at, and she just stays nice and calm right here. Shouldn't like being poked for sedation. Don't blame her. So she's so big, we're gonna have to do a makeshift shoot here. And Dr. Lydia and Haley are getting her moved into the little squeeze shoot situation.
Good girl. It's not a squeeze shoot, but it works. Okay, that's great. We'll just let her take a little snooze in there. And hopefully I can safely get in there without getting kicked.
So Dr. Lydia is putting hay bales up. In the off chance this horse decides to kick, she'll be kicking through a hay bale before potentially contacting Dr. Lydia. So this is definitely not ideal, but she's just too big to go into our squeeze chute. So gonna preg check her, see if she's got a baby in there.
Dr. Scott just told me to just like gung ho, get in there. Dr. Gina was like, look, if you put hay bales up, then they kick the hay bales. And I was like, Dr. Gina's a genius.
So can we just call her Dr. Genius now?
Yes,
Cool.
absolutely.
All right.
Sweet girl.
So for those of you that maybe didn't hear, she said Dr. Gina taught her the hay bale trick.
You can see all the
And it's
scarring.
genius, so now we're just gonna refer to her affectionately as Dr. Genius.
Good girl. All right.
And it is invasive, and she's not super excited about it, but she's being good. And she's probably just a little worried because she is blind, and gonna be getting the ultrasound going here pretty soon. So the big potentially pregnant draft horse is behind me. Dr. Lydia is working on getting the ultrasound to talk to itself so that she can for sure determine whether this horse is pregnant or not, but it's a little slower pace today. Corey's out sick, and I feel like there's a couple other people. Oh, Tawny wants to talk to you, so let me grab the other mic and interview Tawny.
Like I mentioned in one of the members' videos, we have a number of staff that are going through personal things. So if you see somebody's not here, we're not going to answer why they're not here because they have personal things they're dealing with. So just if you're thinking about them, say a prayer for them. It's always appreciated. But we have an amazing team here, even though we're on a shoestring today. And I am so thankful that Haley's here because we would be really up a creek without a paddle if we didn't have Haley here to help us hold horses, because a lot of our team that are very important for doing buyout are not here today, and we wish them the best.
Here are some of the 21 horses. 21 horses came off this trailer. 21 horses saved from potentially entering the slaughter pipeline. These horses will never know the horrors of the slaughter pipeline. So thank you guys so much for your support. And I'm going to get back to the pregnancy check. Just wanted to, I realized I hadn't told y'all, how many horses did we rescue so far today? It's 21. And I don't know for sure if we're getting any more today or not. I do know that we're supposed to be getting some more soon. So we'll see. Oh, Tawny wants to talk about this too. So let's go find Tawny.
There was a horse that tested positive for EIA. So it's Coggins test tested positive instead of being negative. And it was at an auction in Texas. And that auction's very prominent within the slaughter pipeline. They have thousands of horses they deal with. Everything's been locked down there. We have gotten, a couple months ago, we've gotten horses basically on backhauls from that auction. And so we had to be extremely careful during this buyout, make sure everyone has Coggins, they got their health certificates. We have another group of horses coming in, but as a precaution, they're not supposed to have anything to do with Texas, but we're having them go to a vet office and get their health certificate and Coggins done, and then once it's fine, then they'll come here. So they should be here next week. We're just doing everything we possibly can due to this exposure of this really bad disease in the slaughter pipeline from an auction where we know horses in the past and donkeys have come. So we're being extra cautious. So the buyout's being spread out a little bit because not everybody's going to come in today.
He's in me. All right, I'm going to give my arm a tiny break.
Overheard Dr. Lydia saying she's not seeing
You guys.
any evidence of a baby, so.
She's got a lot of fluid in her reproductive tract.
A lot of fluid, but no sign of a baby,
Palpate with no ultrasound here.
so. Oh, propane truck, okay. So Dr. Lydia,
Feels totally normal.
Dr. Lydia says everything feels normal. No sign of a baby. If there's a baby, I'm going to jump back on here and let y'all know. But as of now, no sign of a baby.
I'm not sure why.
Emily's going to be giving her everything that she needs: microchips, vaccinations, deworms, all kinds of amazing things.
Okay.
And meanwhile, over here,
Oh, you're so cute.
we have a little mule in the shoe.
You're on? You do cookies?
And Dr. Lydia is trying to make friends here.
Yeah, he says no thank you. Do you kick? Hi. You want some treats? All right.
Hello, cute guy. How you doing today, huh? And while the camera was off, little mule jumped into the squeeze chute. So now little mule's in the squeeze chute.
You need anything?
I want to hold her head.
Yep.
She thinks
Yeah, she's
Strangles
very-
is a toy.
She's very bad with
She's trying to eat.
she's bad with orals too.
I got her oral.
Okay.
Snuck a turd in there.
Good job.
And that was the shingles vaccine.
Okay, is that it?
Nope.
Nope. Okay. She doesn't really like Cokes.
This is something you don't see too often, is Dr. Lydia having to stand halfway up a gate to get over the top of a horse. But this is such a big horse.
You want to scan that?
And now she's microchipped.
Oh,
And
you might need to
it's going to be
squeeze in a little bit to get blood. Let's, Haley, you hold that out there on that side, and then I'm going to close this. Yep. Perfect. You got it? Yeah. We close this. We're going to squeeze in a little bit.
This is how we get blood on a horse that's not trained to stand still for us.
So handy.
Yeah, because
Okay.
keeps us safe, keeps the animal safe.
I think we can unsqueeze.
Now we have Coggins blood on this mule.
Okay.
Alrighty.
Do you mind holding this gate over here for me so it doesn't hit her?
Now she's getting moved to a temporary holding place. She's blind, so no sign of a baby in or out. So
We're going this way. You're all right. We're going this way. Good girl.
it has to mess with their mind when there was a panel there,
Girl.
and then the person saying, "Hey, let's walk this direction." So
Here.
into the stall she goes.
Girl. Okay, you're in a stall. You need to turn it around. Here's some hay, okay?
And she's safe. She's got food and water.
On Tommy or no?
Jordan's here. Did you bring the pizza? Oh,
It's too early for that.
This?
Oh, it's almost 11.
Sweet strawberries.
it's barely too early.
There.
We're looking at for age. That's what we're looking at.
I see all baby teeth. Oh.
All baby teeth. So
So I would call him, those first ones come in at 2.5. So he is under 2.5.
under 2 years old.
So I would call him, let's call him like 1.5. So he's like, okay.
Wow. So
You guys can go ahead and do the pokes. Go ahead and open that side and just palpate it back here.
That one does not open very
Oh, where'd it go?
Yep.
And again, y'all be able to watch this. Faye is videoing for Horse Shelter Heroes. You'll be able to watch this next week. The episode that's coming out this Thursday is going to be what happened last week. But this little guy is getting everything done he needs. He's not happy, but he is a gelding. He's about a year and a half old. So he should be able to go on to be a super, super amazing
He has to lose
little
his
mule.
eyeball first.
But he does have to have an eye enucleation. So poor guy, but for the best, long term.
Mad about this.
This is the next horse Dr. Lydia is going to be looking at. And we'll just have to see what she can find. Tawny said it looks like it has some bad legs.
Wow. Look at the angle changes in these carpets.
Yeah.
These carpets. Hi.
I call her his saddlebred cross.
Wow. This looks bony, but it's all of this up here is soft tissue, and then this is all bony down here. She looks like she
Mare.
fractured both of those carpi.
Yes, this is a mare.
So Dr. Lydia is saying it looks like these are both fractured.
So we can take some radiographs, but this is all rock hard right here on both sides, and then all of this outpouching right here feels to be soft tissue that's kind of extending upwards from this joint, and she's got some heat.
What are
You're
you
being a
seeing
good
with
girl.
her?
So we're going to be doing x-rays on her front legs, see what's going on. But now she's getting her,
So might
Stuff
seem
she
kind
needs.
of arbitrary, the selection of pain medication. In my experience, phenylbutazone seems to work a little better for musculoskeletal discomfort. And then flunexin-meglumine, which is Banamine, kind of works for everything, but it works better for kind of generalized pain or gastrointestinal pain. So because this mare's discomfort, I think, is mostly coming from her knees, I gave her some bute instead of some Banamine. They're both non-steroidal anti-inflammatory drugs. It's like taking Aleve versus ibuprofen versus aspirin. They all kind of work the same way, but we want her to have some pain control before we ask her to walk over here and take some x-rays. You're a very good girl. Come on, buddy.
right out to your waiting pen.
Oh, he's cute.
There he goes. He's gone. All right. So this is the one with the rough legs, and we get an x-rays here in a second.
Nothing but really great. It doesn't actually matter in this case. Okay.
Did we get it?
Get all the crunchiness right here. So we've got some patient movement, but the front of this bone right here should be a nice smooth line and see all of these osteophytes. So let's take the DP. Let's take one more lateral on this side just because we had so much movement. So I think we've got a fracture line running right there. See that dark line right there? Is that a camera?
It is a camera.
Wow, that is like a dollhouse camera. Okay.
Getting x-rays on this poor horse.
Ooh, look at that.
Uh-oh.
Right there.
Uh-oh.
So again, we've got a ton of roughening here and here and here. We've also got a bony proliferation up there. This poor horse. Okay, let's take the DP.
Now they're taking x-rays of her dental. See what's going on inside her mouth.
Ready, 1, 2. Sometimes it's easier when they have palpable dental pain to just take a radiograph. Ooh,
There's her halter.
yeah. So here's periodontal ligament. Can you see right here? That's periodontal ligament, which lies beneath the level of the gums. So her gums are probably right here. So this is her dental radiograph, and it's hard to see on the image, but the level of her gums kind of runs right along here. You can kind of see a little bit of a line. So she's got upper incisors worn to the level of the gum line on the top, and you can see this should be a nice straight line, and you can see it undulates a good bit. These front incisors are super overgrown, and then the lower, I'm sorry, these are not incisors.
Okay, we can start.
These are premolars and molars. You want me to just start over?
Yes, ma'am.
So these premolars are super overgrown on the top. This is the maxillary arcade, her upper teeth, and then this is the mandibular arcade, her lower teeth, and you can see this is that soft tissue structure that's holding her teeth in. She's got a fractured tooth right there. That is her second molar. So she has a lot of pathology going on, and it explains her dental pain. And then this is her right carpus. You can see we've got a lot of bony proliferation happening right here with a possible fracture line on the side right here. And then you can see these should be really nice and smooth. See how smooth the edge of this bone is up there? That's how smooth all of this should be right here on the edges. And you can see how choppy that is and how inconsistent this line is right here. This is partial joint collapse. So that's consistent with that soft tissue component. And then this is from the lateral aspect of this same leg. This is the right front. So we can see a sharp bony spike. So it's not just sitting out there in space. It's got soft tissue structures running over it. The joint capsule is, you can see how cloudy that is. That's all that fluid in that joint capsule that you can palpate from the outside. And you can see how rough and irregular that is and how uncomfortable that must be for her. And then this is the right front. So this is her other carpus. Again, we should see really, really smooth sides, and we've got bumpy little shards of bone happening on all of those sides. We had some patient movement. Oh, we had a lot of patient movement, but this is the right front from the lateral, and you can see how irregular this surface is and how uncomfortable that must be for her. And again, she's got partial joint collapse happening.
So what's your overall diagnosis on her?
So overall, she's got severe osteoarthritis with possible fractures in both of her carpi with a significant soft tissue component that is causing pain. She also has a heart murmur as well as elevated lung sounds. She's got a blown out abscess on her right front foot, and she has severe dental pathology. So unfortunately, I don't think that there is anything that our vet team can do to get her comfortable, and that's comfort and dignity are really important things for us with end of life. So I'm recommending the last act of kindness.
Thank you.
This is the next horse that Dr. Lydia is going to be doing the initial assessment on. Big old bay horse.
No, look, it's all the way.
Oh, it's all the way down.
It's all the way down, and then it's starting to come down again.
Oh, yeah.
See, that's the top of the Galvani's groove.
Yeah.
Right? This looks like it, but look, feel that too, Kaylee. Feel how the groove is down at the bottom?
Yeah.
So I'd put him over 25.
25.
25, Emily.
Good old boy. 25 approximately,
Why is this
maybe a little older.
I bet he's got a big rocket there.
But
Such a
yeah,
good boy.
sweet boy.
We're gonna. Say, I feel great. Kaylee, let me hold him for you so you can put
So he's
your
going to be
leg up, huh?
getting x-rays of this guy. See what's going on.
Yeah, I just gave Dorm 0.5 of Dorm. He's a standard bred. He's got a brand. Oh, we can look exactly how old he is here. I'll get it back.
This poor guy's definitely got a big old wound on his back leg.
Fly spray, my friend. Just don't want him picking at flies while we're taking. Okay. Great, you can pull it out. Tail in the face. How did it reverse this image? This is the front.
That looks like very
Look at that bony proliferation. So partial joint collapse versus full joint collapse makes a big difference in level of comfort, and this horse has partial joint collapse. This looks like a tract running underneath the skin. It looks like we've got another tract running right underneath here. So air is black, and this is the outside of the body, and these little lines where we see these darker areas coming in essentially mean that gas is communicating from the outside of the body into the inside of the body.
Gas basically meaning air. Or
Yeah, or sometimes if you have an infection with an aerobic bacteria, you can have a gas-forming bacteria that's kind of generating bubbles from the inside. But I think in this horse's case, it looks like he has a puncture wound that came through the front of that hock. Very deep into this area, which is right over the hock joint. Our ultrasound is incredible, and I really want to put an ultrasound probe on, but I think that this horse's leg is very, very painful. And in order for me to get that ultrasound image really nicely, I would need to press on the area. And he is sedated, he's had some pain medication, but I don't want to cause him more discomfort. And because we already have that answer from the x-ray, we're not going to do an ultrasound on him. He has a brand, so we're able to look up exactly how old he is, which is always helpful, right? We're always guessing based on teeth. So we're going to look that up and find out how old he is, but he is an older gelding, and we don't want him to be in discomfort any longer. This looks like it happened weeks ago. Not months like some of them, but this has been going on long enough that we've got layers and layers and layers of serous drainage that's probably joint fluid that's coming out in front of this horse's leg. You want to take it from me? You're okay. Good girl. Good girl.
this horse has something very, very major going on. The back
Scoliosis
there.
or lordosis?
We're going to find out what those are today. I think
When your back is a weird shape. Okay, now, and you can go wherever you want. This just felt like a safer option because there were fewer horses over here. But oh, I got some treats. I got a couple. No, I fed them all out. I got no treats. Hey, will you grab us a cookies bag? Hi.
well, this horse didn't want to go out the other way, so we're going to come in this way.
I got the cake.
And did we get pictures?
No, you didn't. Tony, are you okay if I snap pictures of this horse? Yeah. Okay? Haley, just hold right there for 1 second.
And then this horse decided it wanted to be next. Hello. Just came marching on in here and said, I am next.
That nose is so weird. What is it called when like your pigment fades from your skin and it's in splotches?
Usually it's from vitiligo.
It's like vitiligo.
You can get.
Do you want to call her a saddle? She doesn't have a brain.
I actually had to make a real quick phone call and came back and was going to video her loading on the chute, but she jumped right on, so I didn't have time. But she's on the chute. Super, super sweet horse seems so far.
Get photos on her.
Hopefully everything is just perfect with her.
Like a coronet, white, right hind leg.
So she's about 19 years old.
Yep.
And the heart and lungs sound fine, so hopefully she's doing okay. Getting ready to do a dental on this horse, and she needs it pretty bad. And Dr. Lydia is going to get right on that, so that's pretty cool.
Thank you. You're not asleep enough yet? All right, I'll give you a minute. Fine. Jordan, did you want to be covered in horse slobber right before eating pizza? Always. Sorry. All right.
So, Dr. Lydia, what are you
Yes.
about to do?
This mare is about 18 or 19 years old, and thanks to our new dental speculum, doing dentals is a lot quicker. So one of the things we try to do in the first week after intake with these thin horses is do a really thorough look at their mouth and correct any problems. So we're going to do that right now since we have a minute. I'm going to take these from you. Emily, your stuff is over here. And just show your assistant. You're fine. So you can safely hold this if you want to. Just be careful. The side-to-side movement can be dangerous. Oh, you got a great mouth.
Sorry, Haley.
Larry doing?
Hey, what do you need? Hey. We just have some pretty minor, sorry Jason, pretty minor
No, you're fine.
points. Can
Well-
you hold the tongue for me?
How did he get in
Are
there?
you able to hold that? Got it? I wasn't trying to hold your hand with your girlfriend.
Yeah. Oh
Alrighty.
It's such a delightful sound, really.
I love it.
We really should put
That is
that.
the sound of efficiency, Jason.
Yeah.
Those diamond blades are like, take that, T. Right.
And that's it.
That's it.
Man.
That would have been an easily 25-minute hand float.
That's awesome.
Oh man, having the right tools is incredible.
How did his teeth look for her?
Her teeth looked pretty good. She's got, she had some really, really sharp but tiny points along the lingual surface, which is the edge by the tongue, on both bottom arcades. And then on the top right buccal, which is the part by the cheek, she had 1, 2, 3, 4 teeth with really, really sharp little dagger points. But what's nice about those little points is, with that little diamond bladed thing, it goes so fast. The ones that are really hard to reduce are when it's the whole tooth is protruding, but in this case, she had some really, really sharp points. Hopefully that'll make it a lot more comfortable for her to chew and she'll put on weight pretty quickly. I don't think it's something infectious like ringworm, and whatever it is, seems old and resolved. So she's permanently lost pigment here, which I think makes her look really cute. She loves treats and she's very friendly. She's about 18 or 19 years old. We floated her teeth. She got a microchip and her vaccines. She looks like she's got some pretty decent feet, and we don't have any health concerns that we found today except that she's quite thin. So hopefully those really sharp points that we found in her mouth and reduced will make a difference for her, and we'll get her on our refeeding program, and hopefully she'll make somebody really happy. And she's a lightweight because I gave her a tiny bit of drugs. She's really tired. Come on, Mama.
So this horse is about 19 years old, and she just got her teeth floated. She's still a little sleepy from that, but there's no other underlying health concerns. And so that is really, really exciting. And hopefully she can get refed. She'll get up to weight right away, hopefully, and get adopted into an amazing home after quarantine.
Do you have lice, my friend? Why you got the patchy hair loss? Nope. Hey Jordan, can you come rub your head on this horse for me and tell me how itchy you are?
It's only fair.
Gelding is in his 30s at least. His incisors are quite long and quite worn. We haven't looked at the rest of his teeth yet. He's got pretty significant conjunctivitis with some nasal discharge and some ophthalmic discharge. He also has some kind of itchy, patchy hair loss and kind of a thicker hair coat. One of the things that Horse Plus added recently for in-house diagnostics is the ability to test both cortisol and for Cushing's disease, which is hyperadrenocorticism. So it's a adrenocorticotropin releasing hormone that we're able to check here in-house. So we're gonna screen him with the CBC chemistry and also with those other in-house diagnostics. You guys have heard me say this a bunch of times. Age is just a number. I don't ever make decisions based on purely age, but if we're older and have signs of immunosuppression and have signs of discomfort and are very, very thin and are missing teeth, then it's those comorbidities that make the difference, not the age itself. So we're gonna run those tests. It's getting close to lunchtime, so I think I'll be able to run down and run that blood work during lunch, and we'll get some answers on him.
I see that Chandra has arrived, our trusty shelter manager, with the pizza.
All kinds of great food.
Woo! All right.
Yep. All kinds of wonderful stuff. Just beautiful.
Delicious. Thank you. And thank you to our donors. Hold on a second, y'all.
Get a really good look in his mouth.
thank you guys so much for the people who donate to the Pizza and Refreshment Fund, because it really makes a huge difference when we're up here working with the horses and we don't have time to go down and get our own lunch. And it's an amazing pick-me-up for the gift that you guys give us.
He has what I believe to be ring bone or an old scar here on this hind leg.
And they're off for.
Do you have lip tattoo?
At all, it's a bit locked out. So he probably also has pain up here in his temporomandibular joint as well.
Feel better, puppy?
So you might notice this horse has very little mane, very little forelock.
Hey.
Haley went ahead and chopped it all off because of all the cockleburrs in there. So, well, needs to grow back out now. Won't be winning any beauty contests, but with all these scars and bite marks and kick marks.
We're not judgy about your appearance around here. Okay, can I see better than that though? I need to see better than that. Thank you. Well, we're young-ish, but I did not get a great look.
Quarter horse?
So this horse is going to get everything done to it. All the vaccinations,
He could be
dewormings.
as young as like 5.
Yeah, I don't think he's super old.
I would.
Could be maybe 5. So we'll see. Dr. Lydia wasn't able to get a really good age on him because he's moving his head so much. So we're going to work on getting that done.
What did you do to your face? Yeah, Haley, do you mind if you feel safe? Will you walk him a little bit?
We haven't.
I need to look at his teeth again. I got enough.
Worming. Ugh. Yuck, yuck. At least some of it stayed, huh? He's just getting one of everything. And, well, he's not appreciating it. He's not being bad about it.
Let's see what he looks like. Oh, you so mad? Patty, do you want to come look?
So if you keep messing with me.
7 sounds great.
7?
7 years old. Yay.
I was gonna go with 5, but I didn't feel great about it. I feel great
I
about
felt
7.
5 on this side, but
7
then
is perfect.
the hook on the other side made me go
I
off.
love it.
So 7 years old, roughly. Best guess. And then the old nasty strangles vaccine. Oh, no one likes that one up the nose.
It's great when it gets sneezed back in your face. Yeah. Like,
Okay.
gross.
I was standing like, that's $11 worth of nasal drips coming out.
Yes.
So you looked in the pizza box, but you didn't get pizza out.
And he
We're
does
not
have a
ready yet.
microchip? Yep, I do.
Oh.
Okay.
Look good though.
All right.
We love it. We don't have to talk. We're just here.
No one wants to hear my voice.
Oh, everyone does.
This cute little gelding is only 7. He is covered in scars, so we're not really sure what his life history is. He's had some major hoof neglect, but he's been a very good boy. He let us do all of the things today without any sedation. He's very, very friendly. And he got a microchip and his vaccines and some dewormer, and he is going to get turned out into a quarantine pasture to decompress. Are they called burdocks?
Cockleburrs, I think.
Cockleburrs, those like round, I mean, just like he just had like a solid knot of them. So Haley kind of scared. It'll grow back.
So you say it's butchered. She said it's.
It looks beautiful.
That's the best hair. This hair. Look at his
It's
mohawk.
called layers.
Yes.
Layers.
He has volume.
Volume, but you don't need to.
And look at this cute little mule.
She's so tiny.
Little mini mule.
Oh, somebody send Caitlin some pictures.
I don't think Haley got a hold of this one, did she?
No.
She didn't.
Oh, baby toots. I would call her about 2.
Wow, so she's only about 2 years old. Wow.
And she looks like she's had a halter on. Haley, my head is right behind you.
She's gonna get everything. So she's doing good. This is so awesome. Dr. Lydia is checking out this horse. Apparently he's got some discomfort in his back and some swelling on his back right leg.
Wow, this leg is hot.
And it's hot. That's not good.
Maybe a puncture wound back here.
So if you hadn't noticed, we got back from eating our pizza real quick and everybody's satiated. We're all happy now. We're all much more energized. We can get right back into work, getting these horses the intake and assessment that they need. And yeah, we got 8 done before lunch, so that would leave 12 left. So we already did a little mule, and now we're on to this horse. So Dr. Lydia is saying this horse has a 6 out of 6 heart murmur, and that's as bad as they can get. And that's not good. Like, hearts are so important, and just terrible, just terrible.
Oh, woo! So Galvani's groove is no longer present. So over 30.
Over 30.
Thank you. Did you hear it? Yeah.
A bad heart. Poor guy. So happy he came here.
He has some back pain, and you can see the way he's standing. Tawny actually noticed this. You can see him standing kind of camped out in the back. His back pain was primarily right here in lumbar spine, but also kind of back here in his pelvis. His right hind leg is very warm and swollen. He's got some puncture wounds on the back of that leg. And then he's got a lot of scarring. He has more on the other side that could possibly be consistent with a harness. He's got some scars on his knee, but most concerning, he has a very severe heart murmur. So we grade heart murmurs from 1 to 6. Honestly, I think I've seen 1 heart murmur in private practice. We see a lot of them at Horse Plus, and I think often heart murmurs just manifest as a failure to thrive or an inability to gain weight in an older animal. Usually it means that we've got valvular insufficiency or something else like that, but it does put these horses with the more severe murmurs at risk of having a cardiac event. I haven't done a thorough dental exam, but in my opinion, it's not fair to adopt a much older horse out with cardiac disease because we don't know where he is with staging of this, and we would hate for him to go to an adoptive home and continue to lose weight or have a cardiac event and pass suddenly. So I'm recommending the last act of kindness. And this poor boy, you know, he's so sweet, and he's at least 30. I think he's probably closer to 35. And it's so heartbreaking that he probably worked every day of his life for whomever, and then as soon as he stopped being able to do his job, they just dumped him in the slaughter pipeline. Easy. Okay, you're all right. Here we go. What a good girl. All right. Cuckoo for Cocoa Puffs. Looks like you might be able to handle it. You got this.
You ready?
Take the horse out.
Come on, Willie.
Yes. Okay. I'm gelding.
She's like, all right, I'm out. See y'all. Next horse in the chute.
Thank you. What did I say? Oh, yeah. Huh? Did we get photos? We go, good boy. Calvani's groove is all the way to the bottom, so he's at least 20.
Doing just good for his Coggins pole.
Boy. You have a mustache, madame. Hi. Why are you so covered in scars?
It's like if they're big meat.
Wow, his hair is very soft.
He is very soft. Oh, you're gorgeous.
I do believe he's a
So-
gelding.
This little guy is only like 2.5 years old. So we got some nice youngsters in this group, and that is so awesome because, yeah, youngsters have such a long life ahead of them, and saving them from the slaughter pipeline means that they're going to be able to live that long life in a wonderful home. And Haley decided to brush this one out instead of just
Yep,
chop
I
it
got a
off.
testicle.
He needs to be gelded.
Well,
Poor guy, no wonder he wants to leave so bad.
The crypt orchid?
I think I can feel the second one. He's definitely intact. Another one too, it's just sometimes hard to palpate when they're small. Based on his incisor eruption, he is right around 2.5, so he's very, very thin. He's kind of covered in scars, but he's been a good boy, and we will castrate him and hopefully get him rehabilitated so he can make it to a new home.
Joining at this little, well, it looks like a youngster caught up.
It's a youngster, but somebody's done stuff with this horse.
Someone's definitely done some stuff with this horse. Very nicely trained. And hopefully Dr. Lydia finds nothing wrong with this horse.
Yep.
And this little guy's a stallion, so he's gonna go out here by himself for now.
Here's some water in just a second. Okay?
And hopefully tomorrow he can get his gelding operation. So he's a really cute little guy. And what was he, like 2.5, I think you said? Yeah. So less than 3 years old, so that's really awesome. She's like, no, I don't want to hold her.
Nice Roman nose.
She's been very, like, interested. Like,
She hardly ever calls me by my name.
she meant you were agile and good at climbing.
Her favorite thing to call me is legs, especially when we're out in public, because it makes people question why she's buttons all come around the corner.
So this is going to be the next one after the gray is
She's not
done.
branded.
But we did hear we're going to get some x-rays. So
She's only like a
okay.
3-year-old. This little mare, we don't have an age on yet because she's seems to be afraid of us, and so we haven't really messed with her mouth. I did sedate her because this left hind leg has, I haven't touched it yet. It's got a lot of abnormal bumps there. I won't call them bony or soft tissue till I can touch them. I'm looking at x-rays. So we sedated her. We're gonna hopefully get her to stand on this, and then we're gonna take some x-rays and learn what we can about that. Sometimes we have really awful looking bumps that aren't uncomfortable or life-threatening, and sometimes they are. So thankfully we have the diagnostic equipment to rule things in or out. So that's what we're about to do.
Getting mane detangled and brushed out. And we get x-rays on that back leg here real soon. Get an x-ray in the chute.
Yeah. Right there. And right there.
A giant chunk.
Yeah, that's a fracture. We really can't get a DP. I'm gonna try to touch it.
Good girl.
That's a fracture.
So what's it looking
Dang
like?
it. She's got a fracture. A pretty significant one. Great job on these, Emily. So you can see we've got pretty severe bony remodeling over here, but this is our fracture right here. And then we took a DLPMO, so this is an oblique, and you can see that big chart of bone is just kind of hanging out here. So it's just got to be really painful walking on that.
It's too bad. So sad.
Hi, sweet thing. I knew you're a baby. Emily, we're going to want to take radiographs of this horse's right front leg,
Come on, bud.
basically from the carpus down. Come on. Good girl. just gotta put your head down a little further. Listen, it looks like
Some horses just don't want to get in.
oh, there is. Good girl. There we go. I'm sorry about your leg. I'm gonna get you some pain meds as soon as I can, okay? But I think it's worth noting. We always try to do the most critical ones first. None of these horses are gonna touch them. So. You can only provide care in as much as you can access the animal. Poor thing.
All you gotta do is walk in.
Right front.
Like, I don't want to walk in, but you need to walk in. Dr. Lydia wants you to walk in so she can treat you.
Good girl. You're a good girl. We're just gonna take some pictures of your leg, okay? You're all right. Look at your girl. Right to left.
Oh, you have some cookies up there? Something?
Yep.
There we go.
Girl.
Yay! So this ended up being a 3-year-old stallion,
He's chipped.
and he's got a microchip, and he's got some leg issues, but maybe he'll be fixable. 3-year-old, that's nice and young. He's a big horse, and if he could be gelded and pass the quality of life assessment, that'd be pretty awesome. Dr. Lydia and Tawny snuck off out into where the horses wait to look at that horse. I'm not sure what's going on, but I'm going to go over there and I'm going to find out.
Do you have photos?
I'm getting them. Okay, I'll pull some blood.
So what happened over here?
We noticed this horse was starting to colic, like really uncomfortable, kicking its belly. She's not doing good.
So potentially some colic and
Well, she does.
She is colicking.
Gut noise.
oh,
When a horse's tail has been cut, a lot of times they were, I feel like somebody thought they were going to be euthanized and they paid somebody to take the horse to the vet and it didn't get euthanized. It got taken to the auction instead. And this will continue to happen as long as horses have a slaughter price on their head. But her tail's been cut. We know that there's some other issues besides the colic, but she's painful and that's what we're trying to address right now.
Do we get an age on her? Of the peristalsis of the small intestine pretty continuously when you listen in horses, and to have no GI sounds in any of the 4 quadrants is really serious. She also has a little bit of a, what we call a toxic line on her gums, which to me indicates that she's been sick long enough that she has toxins building up in her body. She looks to be about 25 years old, and you can see the stomping and kicking. So that's one of those signs of colic. You could just go, oh, she has flies, but she's actively kicking up at her belly, and she's been rolling. Unfortunately, buyout days tend to be a bit crazy. Thankfully, Tawny's keeping a really close eye on this group and caught this behavior pretty quickly. And hopefully those pain meds will kick in and we'll have a little bit more time to look at this mare. But it's also really hard to see when they've got their tails cut, because often that means some family that loved this horse said goodbye and thought that she was going to be cared for in an appropriate manner, and then she got dumped in the slaughter pipeline by somebody who thought it was a great idea to take a couple $100s off of her and have her pass in an inhumane manner. So I'm really happy that she's here with us. I'm happy that we were able to get her the pain medication that she needed, and we'll see how she responds to it and take things from there. He's very young. He's only about 3 years old. He has some back pain on palpation, and you can see conformation-wise, he's got a pretty pronounced sway back. A swayback is often something we see in much, much older horses, but this guy's very young. So in his case, it's likely just congenital. Some swayback horses can stay comfortable and can be ridden, but it's often something that we see paired with a really difficult time getting them saddle fit, and also they have some inherent back pain from that. He also has a puncture wound up here on his left hind leg. He has a puncture wound on his right hind leg. And then he's got a very large swollen right front knee with the draining puncture wound. He also looks like he has DSLD just in the right front, which is interesting. If you look at the distance of this joint and compare it from left to right, it's almost like these legs aren't on the same horse. So I don't know if he had such a severe injury that he had part of a tendon rupture on that leg, or if it's just conformation or what, but we're gonna get some radiographs of this guy. This knee is quite hot and angry, and so one of the things that we worry about when we have puncture wounds present over joints is joint sepsis. It's a bit difficult to tell when you have horses with multiple lamenesses, right? This guy, watching him move, is lame, but because he's lame on 3 out of his 4 legs, it's a bit difficult to stage how severe each of those lamenesses are. Down a little bit lower. We're going for this joint right here. Whoop, whoop. Focal distance was a little bit off. So sometimes when you have, and this explains why it looks like he has DSLD on this side, because his suspensory apparatus has torn.
So this poor horse has a fractured leg. He's 3 years old. His microchip was registered to the jockey club. He's got a fractured leg, got puncture wounds in his back legs. He's not doing great, and it's just so sad because he was transported from wherever he was raised, and he's probably sold at an auction into the slaughter pipeline. Thankfully, he came to us. But it's just so sad that he suffered so much in his short life.
Veins are in this horse's leg. It takes a really long time for the body to kind of change its vasculature. And unfortunately, I think this has been the story with a lot of cases that we've seen today. It does seem very likely that this puncture wound is communicating with this carpal joint. Let's get you some pain meds, and we'll take an X-ray.
Let's look at those crazy veins. Not good. Not good at all. This horse has quite the hump on his back, and Dr. Lydia's getting ready to x-ray, see what's going on. But that is just a very peculiar hump, and I've never seen a horse like that. She says it might be treatable. Not that the hump would go away, but maybe the horse has a quality of life, so we'll see what happens.
Baby. Yeah.
How old?
I'm gonna poke you. 2.
2. Wow. Only 2 years old. Would never guess just looking at her.
Yeah, no.
I could argue 3, but we're very young. Okay, Jordan,
Wow.
I'm gonna poke her. Is that a mare?
Hi.
Yes. Hi. I don't need your eyeball right near your friend's needle.
That little baby is so nice. Like, she picks up her feet.
Hey, let's just take the edge off. Good. This draft filly, this little mare, I guess she's about 2 years old, has very severe abnormal angulation of her lumbar spine right here. Sometimes there are birthing injuries. This feels quite firm over here. So thankfully we've got radiographs and ultrasound, and one way or another we're gonna get more answers. She doesn't seem to have pain on palpation of the area.
Getting x-rays of the big hump on the horse.
Whoa. It's pretty crazy. All right, I'm gonna have you. Is whether there was an injury. I'm going to have you hold the plate in the same spot again, and I'm changing the angle of the generator to get different views. Here. A little further caudal towards her tail.
Yeah, on her.
A little bit more.
Looks
Like
Just
instead of
slide it,
tilting
just slide it.
Move the whole thing. Oh, watch out. Drop your hand towards the floor about 2 inches.
Which hand? Both of them?
Yep.
Is it like that?
Moving. The more power you use to shoot through, the grainier it is, and so any patient movement matters.
Whoop.
Patient movement. Non-diagnostic. All right.
Ultrasound time.
Yeah. I think this mare is stable for now. She wasn't painful on palpation. We haven't been able to assess her gait or her level of comfort doing anything other than just standing, but I do think that she is comfortable enough. We're going to process her today. We're going to microchip her and vaccinate her and get her turned out in a pasture to decompress. I would like to do a lot more ultrasonography to make sure she doesn't have other congenital problems with her major organs or anything like that, but cautiously optimistic that we'll get her through to adoption. So she's going to get all the things.
So believe it or not, Dr. Lydia says this is congenital. Horse seems to be comfortable, so obviously not going to be a riding horse, but going to be put out in the pasture, decompressed, given all the vaccines, deworming everything, and we'll see how she does. See how she does over the next 30 days. So these are two of the horses we haven't seen yet. And then we've got this one here. Justin's working on the members. Hopefully I don't get kicked. That's the one with the humpback. There's this super cute little baby right there. And then we swing this way, and we've still got a couple horses out there. But I've got to go get this edited for you guys, and I don't want to be out till 6. And somebody's coming to work on some of our equipment, and I want to be involved in that. So I've got a super busy evening for me tomorrow, but again, 21 precious lives saved from the slaughter pipeline. Thanks to your donations. I'm going to go catch up with Tani. I'm going to get some of her words on how today went. She's been hands-on involved with every horse, so let's go see what Tani has to say. How did today go?
Today is still going. We're getting close to the end. There's still a number of horses we're still working through. I believe we've gotten through most of the critical ones. We still have one that's colicking back there we're watching, but overall it's really good. There will be another group of horses coming in, but due to the outbreak in Texas, we wanted to make sure everything's very thorough. So they went to a vet to have their Coggins pulled again and new health certificate. So they'll be coming in next week, and we will be doing the Horse Plus retreat. So I won't be here to see it, but we've got a great team here and excited about that.